Hey, it's Jessica DaMassa with HIMSS TV, and joining me right now I have Dr. Simon Kaz. He is the Chief Medical Officer for Microsoft. So welcome, it's good to speak with you.
Thanks, Jessica. Great to be here.
So talk to me about what Microsoft is doing. I mean, we always love to talk to the big tech companies about what's going on and what you're working on in terms of healthcare. And so I know we've talked and you're responsible for just making sure that everything is, relevant and medically sound at Microsoft. So talk to me about some of the things that you're working on.
Yeah, so the Microsoft Health business is, most people probably aren't aware of it, but it's a large business. We are a platform and productivity company, so on that platform we've got 14,000 partners around the world. They help us scale to our 168,000 customers, and we do a lot. So we've got a lot of products.
The diversity of what you do is really actually quite impressive. So I mean, you had mentioned you do everything from like AI and working with data all the way to, we have the Hololens right here for anybody who's wondering what's in this case, if you want to show it.
Sure.
I won't show your show and tell.
Yeah. So this is a Microsoft HoloLens.
Yeah.
This is part of our innovation agenda, but certainly what we do is more than that.
Right.
If I had to boil it down, I'd say we're trying to help the world securely adopt the public cloud and then use it and the data in it for purposes like artificial intelligence so that we can actually transform medicine.
Okay, and when you say transform medicine, what types of goals, I guess, does a company like Microsoft have in terms of transforming medicine?
Yep. So I look at our health systems around the world, and I think they're last century's health systems aimed at fixing last century's problems.
Okay.
So great for battlefield trauma, infectious disease, not so good at managing chronic disease and healthy aging. So I think we need to reform our health systems, and to do that, we need to leverage models so that we can effectively distribute our workforce. Telehealth, telemedicine, so we can scale those doctors and nurses out to where the patients are. I think about how do we actually use the data. There's so much of it in healthcare, but we don't actually use it for secondary purposes to better understand what we're doing. The role of artificial intelligence, the rise of precision medicine, all of these are key focus areas for us.
So are the challenges that we have in healthcare, do you think a lot of them are related? Is this a productivity problem? Is that how you guys are handling it then?
I think it's best summed up by the quadruple aim. Are you familiar with that?
Yeah. Mm-hmm.
Yep.
Yeah.
So if I had to look at a scorecard of healthcare, I'd think we're not doing well in patient engagement.
Right.
There's a lot that we could do to put health information and the data into the hands of the patient, help them self-manage. The clinical productivity angle has mostly been serviced with electronic medical records, and I think there's so much more that we could do with technology to support them. As far as population health and population health management, that's an acute problem, and we need to do so much better in that area. And having the data and managing populations with data is really important. And then on the final thing about containing costs, everyone's looking to contain costs,
right.
And I think there's a big role for technology as well.
Well, talk to me, I guess, give me some specific examples of projects that are in flight then at Microsoft that are trying to tackle these.
So I'll tell you one that's close to my heart.
Okay.
At Children's Mercy in Kansas City, they look after kids with the most severe congenital cardiac defects. And for their hypoplastic left heart kids, they need 3 surgeries basically before 3 years of age, and it's got a pretty high mortality rate, about 25%, and most of the kids get into trouble at home with their parents because they don't cotton on to the signs of deterioration fast enough, they don't live close enough, and now they've got a virtual service where they've got the parents, instead of recording on a paper diary, they do it electronically, so it goes real time. They're recording video, so the care team can actually see what these kids look like. And now that they've got 3 years of video data, they're starting to use artificial intelligence so that we can start to take the load off the humans, put it on the computer and manage these kids better. Their mortality is below 3% now, and they're scaling it out nationally. So that's really exciting.
That's very exciting. And I want to ask you a little bit too, it sounds like Microsoft's approach is very different than some of the other tech companies that are in this space, and everybody here has been watching so closely what Apple's been doing. Mm-hmm. So, what are you guys doing? I guess, how are you tackling this problem in a different way than what we're seeing come out of Apple, which is very focused on, engaging the consumer through the Apple Watch, and they're doing a lot of work there on the consumer engagement side. Would you say that Microsoft's approach is similar or different? And
quite different.
Okay, how?
So we think about Apple as a partner in the ecosystem. They are a phenomenal to-consumer company, and Microsoft, most of our business is to enterprise. So if I had to boil it down, we do 3 things at Microsoft.
Okay.
We engineer software platforms that others use. We support partners as they assemble that and take those solutions to market. We do some of our own first-party research. So the role that Apple plays with consumer is an important final yard in completing the loop. We're very much building the infrastructure that the health world needs to use to operate these systems securely, safely at scale, and bringing down the cost of some of these things as well. You'd need a supercomputer to do some of the precision medicine, artificial intelligence stuff, and not everyone can afford supercomputers, but we have the cloud, which is the world's biggest supercomputer.
So what are you most excited about, I guess, from an innovation standpoint in healthcare? I mean, you've kind of got the world at your fingertips here, really, I mean, in terms of what you're talking about, and you're tackling big systemic issues and workflow issues and data issues and things like that. So what technologies are you most excited about and integrating in to help improve the way that we deliver care?
Yeah, so I think about how fragmented healthcare is at the moment, and when I was practicing as an emergency doc, that was incredibly frustrating to know that the information was there. I just couldn't access it when I needed to make a decision. So I think as we start to shift to the cloud and bring systems together with new standards like FHIR, we create data liquidity. And that's good because for the clinicians out there, they can better service patients. But it's also great because when we have data available for secondary purposes, we can start to use it. And I heard a presentation yesterday, a gentleman talked about the art and the science of medicine. And there is a lot of art.
There is.
And despite the fact that we try and be evidence-based and data-driven, that's the science part, and that's where computers can help. So I look at both my parents, they're radiologists, and then I see the changes coming in terms of diagnostics. We're doing increasingly using computers to assist clinicians, and they can read x-rays, digital imagery of eyes, interpret skin lesions faster, cheaper and more accurately than clinicians can. And I'm really excited about the role of what does the role of the clinician in the future supported by artificial intelligence look like.
How far away are we from having that completely empowered physician who's got all of the data at their fingertips and is able to use technologies like you just described? How far off do you think that is?
Depends on your definition of artificial intelligence.
Okay.
I think we're well over a decade away from AGI, artificial general intelligence, where you've got this sentient computer that's all knowing and all intelligent.
Yeah.
But
how far away from
applied machine learning scenarios, they're happening today. And they're happening all around the world. I see phenomenal examples of readmission management, of monitoring populations with chronic disease before they run into problems and require hospital admissions, deteriorating patients in hospital. Natural language processing is really come up in recent times.
The last 2 years especially, it seems like there's just a preponderance of integrations and solutions developed with that to bring it, into the system to mine all of that data that we haven't been mining so far. Do you think? I mean, how far? I guess the other question is how far are we from from true interoperability and achieving that data liquidity that you talked about? Do you think that that's on the horizon?
We've got all the technology to do that. There's a lot of inertia in the system as it is, and enormous complexity.
Yeah.
The average hospital has more than 1,000 systems, and some of the system refresh time can be as long as 20 years. So we've got a long tail to work through. But I think the key is how do we tackle the core systems. And the Epics and Cerners and Allscripts of the world are our partners. We work closely with them, and their mindset has shifted from this is a threat to our business to this is a huge opportunity. So we're now seeing FHIR-based application stores for some of those big vendors, and that's an opportunity to bring lots of diversity into their ecosystem. I think creating that total open ecosystem that's entirely plug and play, we're a long way off that.
Do you think we'll get there? Or is that something where the Epics and the Cerners and the Allscripts of the world are going to close the door?
I don't think we need to get there.
Okay.
I think if we move further along the interoperability and the open systems continuum to the point that the core systems are able to share data interoperably, I think we're there. And the technology is there, and now it's a matter of just getting it out there and doing the hard work. It's not sexy, it's not fun, but creating that data liquidity is how we move forward into the digital age.
Exciting stuff. I'm so looking forward to this future of medicine as you've described it. I love it. Thank you so much for joining us here. It was a pleasure to speak with you, Dr. Kaz.